Okay. Today's morning medicine is coming live. You're live now. Yeah, last time I did one of these, I was live. You said too, and it didn't work out. Okay, today is Aranea Diadema. And tomorrow looks like Aranea diabola, which is tomorrow's a cross spider. This is a papal cross spider. So I don't know what the difference is. Same animal, a spider, and any spiders are nervous, very can't sit still, this kind of things. Anyways, Grovagol is our chief authority for the use of Aranea. It is one of the leading remedies for the hydrogenoid constitution. In other words, they don't like to be near water, they don't like cold, that kind of person. As described by him, and for intermittent fevers and other intermittent disorders, which is like malaria and different things like that, flus, colds, whatever. But hydrogenoid, hydrogenoid constitution, he meant abnormal sensitiveness to damp and cold and inability, to live near fresh water, either rivers or lakes or in damp, chilly places. This gives the worst from bathing from the damp weather, localities or habitations, worse drawing in cold air. Grimmer says cancer of lungs. So cancer of lungs is a 3. That's another homeopath. And that Gravagol, he's got hydrogenoid, oxygenized, I don't know, 3 different constitutions. But cancer of lungs, Grimmer says, with hemorrhage. So they're bleeding, they're coughing up blood, which can be tuberculosis, some other things. Cases based on the tubercular miasm. There we go. And it doesn't have to be they had tuberculosis. They could have inherited it, the miasm from their parents and that. Very sensitive to dampness and rainy weather. Marked periodicity of symptoms. So the symptoms come on same time every day. The cough, the flu, the cold, the chills, whatever it is. Clock-like regularity. You could set a clock to it. It's if it's 4 o'clock every day, 4 o'clock every day it comes. Reoccurrence of symptoms and conditions. I ain't saying this one's 4 o'clock. All right. So they come on regularly, all the symptoms, and Aranea diadem. Aranea diadem. Papal cross spider. Cancer of lungs is a 3. Tubercular miasm. So that's fuchsia would be in there, a few other ones, but abnormal susceptibility to damp and cold, and that's a 3, that damp and cold. They can't take the dampness and they can't take the cold. So rainy weather comes on, and there's a few medicines like that. Dulcamara and Nat Sulf, they have those symptoms. Better smoking tobacco in open air. Now, if their headache is what it is better by smoking tobacco, I would think you can give them homeopathic tobacco to clear that up. Open air, better in open air. So just get out in open air. You don't have to smoke so much. All right. Anyways, worse cold, damp weather. Exact periodicity, which is a 3. Same time pain or chills occur. Exactly the same times. Nervous, despondent, desires death, alternates happy and depressed. So they're up 1 minute, down the next. So great depression, manic depression remedy, because that's what manic depressions are. One moment they're manic, they're all crazy, and the next moment they're just sitting there and they're all depressed. So distension and enlarged spleen. I'm messing with these markers to see which one is going to keep working and which one, when I got to get rid of them. What the heck is that? Dang it. That looks like a tick. Dang it, I think that is a tick on me. Sorry. I had to get rid of that tick that was starting to bite into me. Must have been my clothes from yesterday or something. Alright. Gotta watch them woods. Ticks Ledum and hypericum is usually what I use. Colic, same hour. So stomach pain, same hour every day. That is that periodicity. Back, icy. And they had blood in there. Polythemia, which is clots. Good to remove clots. Now that thing is itchy. Dang it. Uh, leukocytosis, which is the white blood cells are increased from an infection or whatever. So clots and increase of white blood cells. Pain in intercostal nerve, bright red hemorrhage from lungs, I forget how you say the rest of that medicine, and ferrum phos. Those two also have that bright red blood there. So you'd see Aranea, Diadem, God, I can't remember that, and ferrum phos would all be under that bright red, coughing it up and all that. Um, Pricking pain in right ear. So there's a lot of nerve pain with this medicine. And eustachian tubes. Spreads towards left ear. Double vision, heat, glittering before eyes, before that headache. They get this glittering, this heat, and this glittering before they get the headache. And the white of the eyes looks yellow. So there must be kidney stuff going on here too. That little sucker's itchy boy. Got him before he got too deep into me, that little bug. Pale yellowish. So there's that yellowish again. That's got to do with something with liver stuff going on. In color, the face is pale and yellowish in color. Pain right trifacial muscle. So the muscles, the muscle in that face, that nerve and all that over there is painful. Swollen with toothache. So they get a toothache and it swells up over there. Anybody having a toothache with swelling, this might be one of the medicines to consider. Desires milk, feels soothed by it. Greatly thirsty. Oh, feels soothed greatly. So milk really soothes them, and they're thirsty. And that, like I said, thirsty. It seems like, well, why is that a symptom, or why do you even consider that? Well, we consider that because that can determine between two different medicines. One's thirsty, one's not. You'd give the thirsty one for someone that's thirsty. Numb pain, improved by smoking in the head. They're numb and they have pain, and it's all improved by smoking or getting out in the open air. And like I said, I would try tobacco on them to see. Daily headaches, improved by fresh air. Let's see. So kidney it was in the wrong order. But anyways, palpitations of the heart, kidney, urine's yellow, smells like ammonia. Kidney disease. Yeah, there we go. That's the kidney disease. That's the yellowing of the eyes. And so once you see a person come in, they got yellow tint to their face, they got yellow looking whites of their eyes. You're already thinking kidney. So that might be the direct spot. Anyway, stinging pain in joints, bone pain in limbs, pain in os calcis. What is it? That's the oh god, I forget what that is. Anyways, doesn't matter. Oh, it's a 3, so I probably should figure out what I can't, man. So uh, the heel of the bone. Oh, that's the heel of the bone. That's what. I had looked that up earlier. I knew it. The heel of the bone, the os calcis. I didn't. Yeah. So that's the heel of the bone. As pain, bone pain. Lots of bone pains with this. Worse, continuous motion, or better, continuous motion. So they always want to be moving. That's the way I say they got loquacity, they call it too, which is talkative, very talkative, and they want to be moving around. A lot of spiders, you see them wanting to do that. Sensation of swelling. So the bone in the foot, that could be that, what do they call that? Fasciitis. That could be the bone pain in the foot. Uh, that's a 3. And sensation of swelling of all their parts. Numbness, and parts go to sleep. So their parts will go to sleep. They probably have some tingling and some formication, which is like bugs running up and down it because of the numbness. Pain in right hip to knee. So right hip down to the knee. Arthritis and arthrosis, which is osteoarthritis. So a lot of bone pain, a lot of arthritis, osteoarthritis. Pain in the heel. That could be fasciitis, a lot of itises going on. No liver. Hemoptysis, which is bright red, irritated cough with huskiness. So hemoptysis is just they're coughing up blood. What's the other one? Male, nothing, violent pain in teeth. I did do the woman. Menses too early and too copious. I might have skipped that. Anyways, that's a 3. Menses smell like ammonia. I think I did that. With lump pain in their back. That's that dysmenorrhea. Okay, let's get back to this. Liver, hemoptysis. Okay, male, nothing. Violent pain in teeth at night. Lying down. And it probably got a swollen jaw from it. Lying down and in cold air. Same time each day. Each day they have that pain in their tooth. Uh, So whether it's at night lying down, whether it's in cold air, but each day it's at the same time. That would really makes Aranea diadem stand out. Red copper color of the nose for some reason. Um, and so you always associate an alcoholic with that, with a red nose. Violent and got kidney pains or kidney stuff. Alcohol affects the kidney, so this red nose probably has something to do with kidney stuff too. Violent diarrhea with abdominal pains. Stools are yellow, repulsive, alternate with constipation. So they have constipation, diarrhea, and I don't doubt this happens at the same time every day, and it's violent. Yellow color of the face. That's back to the kidney stuff. Small fissures and cracks in the face. Small vesicles that burst and dry, and abscesses. So they got well, it doesn't, these cracks in the skin doesn't have to be the face, but but they got vesicles that'll burst, like a pimple that will burst, dry, and leave they have mucus, I guess, coming out of it, some kind of pus. Medical. Chilled to the bone, feels parts enlarged. Those are all 3s, and heavier. Periodicity and coldness. Everything is periodically comes on, whether it's a chill or a coldness. The parts feel heavy and enlarged. They're chilled to the bone. Lots of stuff about the bone being chilled. Sensations are, this is just that swelling of things. Sensation, as if enormous enlargement or numbness of parts, worse on waking, or he wakes with such a feeling as everything's numb and swollen and heavy, basically. And they're chilled to the bone. And like I said, Nat Sulf and what's the other one? Nat Sulf and oh man, I can't remember, but I think I read it later. Disturbed, wakes often with swollen sensation. So they'll wake up, like I say, feeling like their arms and legs are all swollen. Cramps after eating. Little bit. They eat a little bit and they get cramps. Nausea, pain as though it will burst. Their stomach will burst. Eructations, tasteless or repulsive. So they can burp. They a lot of burping, and it either can be tasteless or it can be, like a heartburn type of nasty thing. Temperature, chilly day and night. So they're always cold. If you see a person that's always cold, you think of Aranea diadem, especially with yellow face, all that kind of stuff going on. Coldness with pain in long bones. So the long bones in the legs and that, yeah, I think it's just the legs, have coldness and pain with feeling of a stone in abdomen, same hour. So that coldness, pain comes on, and they feel like there's a stone in their abdomen. Painful, red and swollen throat, prickling and burning, even in bed. Painful, red and swollen, prickling and burning in the throat. So this is all going on in the throat, and that could be malaria, colds, flus, whatever. Even in bed, they have vertigo with flickering, like lights before eyes. So that is Aranea diadem. And let's get into some comments. These are always good. The marked indications are loquacious, with painful attacks beginning and ending abruptly. So loquacious is talkative, very talkative, and these attacks come on abruptly. Now that loquaciousness could be the mania, and then they go into a depression. So it comes on, they're manic, and it abruptly leaves. Aggravation from mental exertion and amelioration from pressure of head. Hmm. Yeah. So they get aggravated when they got to do mental stuff, and they're ameliorated when you put pressure on their head. Aranea diadema has chilliness followed by little or no fever. Huh, interesting. So there's no little or no fever, but a great chill. Chill. Now other ones may be what's some other malaria ones? Chikungunya. That may be fever alternating with chill, fever with chill. So this one has little or no fever, and they always get this chill. Chill and neuralgia attacks at the same hour every day, every other day, week, month, or regular period. So whether it's a week, every week they get that, every month they get that, or every um, day they get that the same time, or every other day. So it just comes on the same hour. A chill with nerve pains throughout the body. Okay, attacks are very violent and sudden. Hydrogenoid constitution, which means they don't want to live near water or any damp stuff, or cold. They don't want cold or damp. Abnormal sensitiveness to damp and cold, inability to live near fresh water, lakes, rivers, etc., or in damp, chilly places. And that's thusia, that's what I was trying to think of, and Aranea diadema. Diadema? It could be. It is the what spider? The papal. Papal is sounds like a priesty thing. Papal cross spider. I wonder what's the difference of the cross spider. Well, we'll look at that tomorrow. Didn't look at that today. Okay, vascular and cerebral tension. So the veins in the head got a lot of tension in them, with insomnia, feverish agitation. So they're really agitated. That's why I say when you see the spiders like tarantula and them other ones, same thing. They got a lot of, where was that? That's one of those three. Did I mention that in the beginning? I know I seen that with the two other spiders. Papal cross, Aranea, no. What the heck was that? It might still be coming up. Okay, vascular and cerebral stuff going on, the head and the veins, a lot of tension with insomnia, feverish agitation, clouding of consciousness. So, a lot of people used to think, what's wrong with that person? He's crazy. A lot of times it's a condition that they have. And the vein, there's a lot of tension in their veins and their head and everything, and they get manic and they start talking a lot, and yeah. Neuralgia at regular intervals. So nerve pain at regular intervals, especially of the trigeminal region, which is the face. Occipital nerve and of the limbs. So face, limbs, and back of the head. Occiput. Gastric and intestinal complaints, as well as genital and urinary complaints, mostly cramping pains. So a lot of this gastric stuff is probably, they probably got a gastric headache, The patient thinks his illness is improved by smoking, but the symptoms always recur at the same hour. So it's not the smoking that's doing it. But I would still consider giving tobacco homeopathically. Hemorrhages from many parts, from wounds, puncture wounds. I thought it'd be hemorrhages from the lungs and that. Exhaustion, and it could be hemorrhages from many parts. There's no period or nothing. From wounds. Pains like electric currents. So that's the nerve pain. Great desire to lie down. Many symptoms better lying down. Sensation of swelling, and they get real tired. They can't move around. Sensation of swelling in many parts. Head, face, hands of numbness and coldness, as if the bones were made of ice. So they're chilled to the bone, and that's what I forget which one would be chilled to the bone. Let's see if they would tell us in here. 19. Mygale, Tesla, okay, Therodon, Hippocampus. Okay. There's a few medicines: teletheridone, tarantula. There's tarantula. Ipecac, nux vomica. Those ones would be comparative to this remedy. Aranea, diadema. Lachesis, that's a snake, has greater loquacity, talkativeness, and hypersensitivity to light touch. So they don't want to be touched. Lachesis cannot bear the any constriction better from menses. Okay, so their comparison lachesis, snake poison, to that, and they don't want to be touched, and they, you know, they're a lot of talkativeness, just like Aranea. Intermittent hot climate, Aranea of cold climate. So Cedron, I think it's Cedron, they have intermittence, things come on at the same time, of hot climates. They don't like hot climates. And Aranea doesn't like cold climates. So that's how you tell those two apart. Chiefly cold climates chiefly. Okay, apis, which is bee venom, very sharp pains. That's at nerve pains, which are worse by heat, and partial or generalized edema, swelling up and fluid retention, occurring suddenly. So apis, that's how you compare apis. They have sharp pains, and it's worse by heat, and they got a lot of swelling, which is what Rania has. Anyways, formic acid. Its action is directed toward cutaneous and mucus allergies. So this, Arania for certain allergies. This is all in the mucus area for formic acid. For exudative tendencies, actions on neuritis, arthritis, or arthrosis, which is our osteoarthritis. So this formic acid is good for all those arthritises, those bone things, and you tell them apart by the allergies, I guess, all on the mucus side of the problem. Paris quad, neuralgias, and Bar-Leon's syndrome. So that would be one you can pair with Aranea, and hypericum. So hypericum is definitely nerve pains. So Aranea antidotes china and quinine and mercury. So those three, if you had someone overdosed on them, you give them Aranea, it would nullify it. Same, and it is antidoted by smoking tobacco. Huh. So that's why I would say tobacco. I don't know why that's not in there, that you try giving tobacco for the headache or for some of the symptoms. They're talking hypericum would be compared with the nerve pains and that. What was the other ones? Anyways, that's how you compare them. You take the symptoms of that person, and this one has a set of symptoms. What was it? Sidron or something. Anyways, that one likes hot weather, or can't stand hot weather, and no, likes hot weather. No. Can't stand hot weather. And I think it was Apis. They don't like hot weather. Whereas Aranea, Diadem, they don't like cold weather. So that's what you're doing. You're basically talking to a person, writing down what they say, finding out what's the chief complaint. What would you like to get rid of first, is all what I usually would say. I learned that from a lady named Cindy. And anyways, you would find out all these symptoms, figure out, and right away you're like, okay, yellow eyes, yellow tint to their face. You got some kidney stuff, you'd be aiming at the kidney. That would help you to, get kidney remedies that would be good for kidneys. And then you would, once you do all that and you get the symptoms, and like you said, you underline them. A 3 is a really important symptom. A 2 is there, and it's, to be considered. And a 1 is small and probably nothing. But you take all these symptoms, you figure out, and like I said, when, you got to watch what patient you have. You have an intellectual, they're going to tell you what they have and how to fix it. Hypochondriac, they got everything. And an open patient, they just start babbling. And a closed patient, you got to pull things out of them. So, yeah, as you know, once you get through all that and you understand who you have, and once you see the eyes being yellow and the face being yellow, you start asking certain questions about kidney, their desires, sweets, sugars. Are they thirsty or not? That could help you determine between two different remedies. So now, you, I showed with the three underlines, and if you just change those underlines to different symptoms, what was it? A three on worse movement is bryonia. What was the other one? There was another medicine. If it was a three, Berberis. If it was a three on, I forget what Berberis was. It would be that one. So when you have, if you don't hit the center of what's going on and what's an important symptom, which the liver would or the kidney would help you with that. If you don't hit on that, then you might start repertorizing. In other words, going to the book with a symptom, a condition that you start looking at, and it's off the mark. So now you're trying this, you're trying that, and that's why even the old doctors, when they started into homeopathy, they didn't, some of them were like, wow, this is amazing how it works. They all were like that. When they seen the healing that he was getting, he was like, I think he took care of a what was it, a cholera epidemic, and then he took care of an influenza epidemic. And when they were like, wow, and they started into it, but then they would realize, man, this is a little harder than it seems. Now, it doesn't have to be. It all depends on our energy we come in with. Are we open? Are we ready to prejudge this? Or so if you come in open and you're just taking symptoms, and then like I say, you scan them, you see what's going on. Okay, you get a bunch of symptoms. Then you go in and you analyze. Oh, this symptom you said of, you get these headaches, and if you go out and smoke or get in the fresh air, the headache goes away. When does this start? When does it come on? And the stomach stuff. Is that you got stomach stuff at the same time, or what's going on there? Um, you know, just start asking these analyzing questions. What's going on? And then probe. Now you go in and you got to really, and some closed person, you'd have to go in and just start probing because they're not giving you nothing. And then you probe these situations to see which one is really important, which one isn't, which one, so yeah, a lot of factors to consider. But like I said, I can show you how it can be quite easy to, some of them are harder, you know, they're not harder. It's the attitude you come in with. The person, like my wife, I was just going for the foot with the bubble on it, like, man, what is this bump? Oh, it must be ligaments, must be tendons, must be, oh, let's do ruta, and then pains in the legs, and what was the pains in the leg? Calcarb has all these symptoms. Okay, give her calcarb. Pains in the legs sort of went away, but yeah, they come back. So did I palliated it, or did I? And so anyways, I'm like, look, and I'm thinking, okay, let's just sit back and think about this. Let's stop trying to analyze it and say, what picture? And that's what you really want with all this, is a picture. And the picture was, she likes soda pop, loves soda pop, drinks it day and night. Wakes up to one, has one later, has one, and yeah, she just drinks soda pop all the time. So phosphoric acid loves bubbly sodas, and that's the bubbles is the phosphoric acid. So I'm like, okay, that looks like the picture. And I kept thinking this woman is acidic because she doesn't eat vegetables. She drinks a lot of pop, smokes cigarettes, eats, like pancakes and rice, white flour, white bread, some eggs, things like that, and doesn't really get a balanced diet. So I'm thinking she's acidic. So phosphoric acid seemed to take it away. I'm going to find out. She went away for the weekend, went to Maryland where where a lot of rain was happening. I don't think they got all that flooding rain, but anyways, she'll be back today, and I want to find out and see how's the legs still doing. Are they aching still, or now I would like to feel that bump on the bottom of her foot if that's receding. Because if the phosphoric acid goes in and the vital force rises up and says, oh, let's fight this phosphoric acid, or, it's vibrating with the vital force, that will cause the aching to go away, and that'll cause the body to absorb that thing in her foot, or if it's like a vesicle, a carbuncle, anything on there, it will push that out, and the thing will burst and it'll clear up and it'll go away. So I'm interested to see what's gonna happen there. All right, that is morning medicine. You can age, but you don't have to get old. Aranea diadem, which is papal cross spider, and Aranea diabola is tomorrow's, which is just a cross spider. I'm gonna see if I can figure out the differences between them. All right, that's morning medicine. You can age, but you don't have to get old.